This segment of Bridge Street is sponsored by CNY Cosmetic and Reconstructive Surgery.
Well, this morning, our neighbors over at CNY Cosmetic and Reconstructive Surgery are filling us in on the latest trends in breast augmentation.
Dr. Gregory Baum and Dr. Anthony DeBoni are here this morning to help us break it down. They join us with more. Good morning.
Good morning, ladies.
Thanks so much for joining us. You know, Dr. Baum, you brought along some implants, right? They're different kinds of implants, if you will, right? Should we start with that?
Sure. What I'll do is I'll talk about maybe the one on the left, which is a saline implant.
Okay.
It's round. It's also textured. And basically the broad classifications, they either come as round or anatomic, saline or silicone, and either smooth like these or textured.
Can we?
Sure.
So the texture, because what's the purpose of the texture if it's inside of your body?
The whole purpose for the texturing is to hopefully that your body will encapsulate or form a scar capsule around that implant. It would adhere to that texturing so that that implant doesn't move.
Oh, so because they can move.
They can.
So that's a possibility with this one, right, Dr. DeBoni?
Right. Well, the smooth implants are designed actually to move within the pocket. So the textured versus smooth are used in different applications. Most of the implants we use these days now are actually smooth. Without getting too much into the details, there has been some issues related with textured implants, so we've gotten away from using those. But the theory on the texturing is that it will keep the implant more fixed in a certain position, whereas the smooth is going to move around in the pocket a little more, which some feel may have a more realistic feel.
That's what I was going to say. I feel like the stigma behind breast augmentations, or what some people call boob jobs, has really gone away. I mean, you know, nowadays people are, you know, it's more common than not to have this procedure.
It actually is, you know, up until actually this year, it's actually been the most popular cosmetic procedure done as far as when the Society for Plastic Surgery ranks the most popular procedures. So it's very common. It's very, it's certainly still very popular. And something we do routinely.
Now, this is sort of heavy to me, I'm thinking, right? But people choose different sizes and shapes. I mean, and how does one, you know, choose something like, I'm sure you guys are experts in this, but yeah.
Right, well, they both saline and silicone come all different sizes.
Okay.
So these are just examples. You can have small saline and small silicone and large silicone.
I see, okay.
So typically when someone comes in for a breast augmentation consultation, we have silicone trial sizer implants in the office that you can try on to see what size fits you best. Correct.
Okay.
Yeah. Now, is there a liquid in this or a gel?
Yeah, so that one, saline is just filled with basically the same normal saline that we put into an IV. So essentially those, the saline implants come deflated, they're placed, and then we fill them up, you know, in the operating room to the volume that implant is going to hold. Silicone, on the other hand, comes pre-filled from the manufacturer, so they are sealed and as is.
Correct. And you have an example there, a sample there that you showed, because I asked you, I'm like, do they still leak? You know, because I know back in the day that was a big issue, that your implant would leak.
Right. So all implants are going to leak. In other words, you know, implants are not forever. They're not lifetime devices. So eventually they're going to fail. The older silicone, which people were having a lot of concerns with, was a much more liquids-based silicone. The current implants that we use now are what we call cohesive gel, or some people call them gummy bear. So what they are is the silicone inside is actually form stable or solid. So this is a cut implant, and you can see the gel is
interesting.
Solid, so it comes right back to its shape. So it doesn't really leak out, it just stays solid. So when these implants break, the gel is not free-flowing.
Yeah.
Now, something that people are always concerned about too is like the incision and what that will look like. Yeah. So are you much more advanced in that in terms of like, is it a smaller incision these days?
It really depends. So the incision is got to be big enough for the implant to go in.
Okay.
And actually, the saline implant, which we can put in deflated, we have it deflated and roll it up, can actually go in through a smaller incision than a silicone implant. A silicone implant being solid, the bigger the implant you put in, the bigger the incision. But we do have some techniques to put in the implant with a little injection funnel. And still, I think that, you know, we both use very small incisions, the smallest incision possible to get the implant in, and also it's very well hidden because we tend to put it in the crease underneath the breast where it tends to hide underneath the breast itself.
Now, we're out of time, but I have one more question because it's over the muscle, under the muscle. How do you decide?
we do both, but by far most of the implants today are put underneath the muscle for a variety of reasons. The people that we would put the implants on top of the muscle would typically be someone who is a bodybuilder.
I see.
Because they don't want the implants moving when they're up on stage, flexing their muscle. And then certain congenital breast deformities, we will put the implants on top of the muscle. Short of those two options, we almost always put the implants below the muscle.
Clearly, this is a topic that
I know, because I have so many more questions.
Please. Yeah, seriously, who knew, right? Listen, CNY Cosmetic and Reconstructive Surgery is located at 5898 Bridge Street in East Syracuse. You can give them a call or connect with them on social media. You can also visit plasticsurgeryofsyracuse.com to learn more. And starting soon, they're hosting a charity holiday toy drive. Runs November 1st through the 20th. Through December 20th, and every toy donation, you'll get 20% off all skincare products and esthetician services. There we go.
Thank
you so much.
Thank you.
Thank you.
Short walk right across the street over there.
Yeah, we can figure that out.
We'll be right back.